Welcome back to everyone's favorite morning talk show, Wake Up for Safety. We just got word that we've been nominated for a Daytime Emmy in the category Best Morning Talk Show that helps keep people both safe and wildly entertained. They hit the nail on the head with that one, while wearing safety glasses, of course. We're honored to welcome another special guest on the show today, Teresa, a patient access worker from RWJBarnabas Health. Teresa, we always like to start with a trivia question sent in by one of our viewers. And today's question was sent in by Manuel. Manuel says, if at first you don't succeed, what should you do again? Tricky.
Try.
That's correct. Try is something I really need to do to be camera ready at 5 a.m. And T is today's safety acronym letter. It stands for thoughtfully interact. And it's something that you have to do every day, isn't it, Teresa?
It is. Thoughtfully interacting with both patients and colleagues is a necessary component of our culture and crucial to our culture of don't harm me, help me, be nice to me. It's essentially treating others not just the way you want to be treated, but the way they want to be treated. And in healthcare, it can have a positive ripple effect that impacts our patients' experiences, patient safety, and our employees' experiences as well.
Thoughtfully interacting with others is more than just being nice, right? What are some concrete steps people can take to make sure that they are being thoughtful in their interactions?
It all starts with tone. Not interrupting, using courteous language such as please, may I, and thank you, and avoiding the use of foul language or slang sets a polite and professional tone. It's also making a conscious choice to treat everyone with dignity and respect, which can be done by honoring people's individual experiences, opinions, and choices in an intentional way. For instance, always using a person's preferred pronouns or a preferred name.
Wow, a sensitive and positive tone really does sound like the foundation to thoughtfully interacting successfully.
It really is. In fact, tone is so important we designated 5 of them. 5 tones is the name of a tool we use to guide in making sure we're interacting in a thoughtful way with both patients and colleagues. The 5 tones are number 1, smile and say hello. Number 2, introduce yourself and explain your role. Number 3, listen with empathy and intent to understand. Number 4, communicate positive intent of your actions. And number 5, provide opportunity to ask questions.
Why, that's as easy as 1, 2, 3, 4, 5. Do you ever find yourself using the 5 tones tool in your day-to-day work?
I do. As a patient access worker, I'm usually interacting with patients by greeting them, helping them find their way, and answering questions. Recently, I was just about to leave for the day, and I was in a hurry to meet a friend for dinner when I came upon a patient's wife, Mrs. Roberts, who was trying to find her way back to her husband's room. I know how stressful being lost can be, especially in a hospital, so I had a lot of empathy for her. I used the 5 tones by smiling and saying hello. Number 1, introducing myself and explaining that I was a hospital employee in the patient access department. Number 2, listening to Mrs. Roberts as she told me she got lost on the way back from the cafeteria. Number 3, asking Mrs. Roberts if she would like assistance and offering to guide her back to her husband's room. Number 4, and finally, asking her, what else can I do to help? Number 5.
That definitely sounds like a thoughtful interaction with Mrs. Roberts. It's scary when our loved ones are in the hospital, but I'm glad that even though she wasn't the patient, you were able to use the 5 tones tool to help her.
Yes! And while I was helping her, Dr. Soraya Smith was with her husband exercising another tool that is similar to 5 tones, but is used primarily for patient-specific interactions. It's called AIDET, and it's...
Let me guess. An acronym?
You got it!
I'm catching on.
AIDET stands for A, acknowledge and welcome. I, introduce yourself. D, duration for estimated wait time. E, explain and listen carefully. T, thank you to patients, families, and visitors. We know that when we utilize these relationship skills with our patients, visitors, and family members, good things happen. AIDET is a tool that healthcare providers can use to thoughtfully interact with patients to make them feel valued and heard. And in response, patients are more likely to lower their shields and open up about their conditions, allowing us to learn and get the golden nuggets of information to better care for and contribute to that patient's positive experience. Plus, it helps to reduce their suffering. We know that our patients place extraordinary value on having their emotional needs met by our staff during their stay with us.
What does AIDET look like in practice?
We actually have a video of Dr. Smith showing AIDET in action. Hi there, Mr. Roberts. I'm Dr. Soraya Smith. You're welcome to call me Soraya. I've been a physician for 15 years, mostly taking care of older adults like yourself and getting them back on their feet. I'm going to be your physician while you're in the hospital. I'll come visit you every day. Most of the time, I'll be able to get here in the afternoons between 12 and 4 p.m. But depending on what's going on in the hospital, it could be earlier or later. Mr. Roberts, it's a pleasure to meet you. I'll look forward to seeing you again tomorrow. You're in great hands with our nursing team here. But please let us know if there's anything we can do to make you more comfortable. What questions do you have for me?
None at this time, thank you.
What a great example of thoughtful care, and a perfect illustration of don't harm me, help me, be nice to me. Earlier, you mentioned that RWJBarnabas Health's culture had a foundation of thoughtfully interacting with both patients and colleagues.
Thoughtful interaction among colleagues by using the 5 tones tool helps to reduce power distance and increase team communication. Reducing the power distance and tension between team members allows people to feel like they can speak up about safety issues they see, and that directly translates to less harm.
Less harm just by using a friendly and pleasant tone with each other? That sounds like respect in action. Do you have an example of this?
I do. Recently, I had an interaction with one of our respiratory therapists, Juan.
Hello, I'm Juan, the respiratory therapist, and I'm also a safety coach here at RWJBarnabas Health. I noticed how you spoke up for safety with a patient yesterday by making sure they got a broken wheelchair swapped for a working one, and I thought that was a really great catch. I let your supervisor know, and she's excited to recognize you the next time she sees you. Thanks again, Teresa. What else can I do for you? If you ever need me, please come get me.
Even though I felt some power distance between Juan and myself, his thoughtful interaction with me that day helped me know that if I ever have a safety concern again, he would be a person who would listen to me and help me get the problem solved.
I can do that too. So far, we've talked about thoughtful interaction mostly in the form of how we speak to each other, but it's not just about the words we're saying. Are there other ways we can thoughtfully interact apart from how we speak?
Definitely. Our words are powerful, but equally as powerful is the combination of our tone and body language. In fact, there's research to back this up.
Ooh, we love research here at Wake Up for Safety. I hope you brought some data.
I just so happen to have exactly that. There was a study by Dr. Albert Mehrabian, a psychologist and professor at UCLA. Dr. Mehrabian was interested in the impact of verbal and nonverbal communication on our impressions of each other. His curiosity focused primarily on the effect of inconsistent messages. For example, saying yes although your arms are crossed and your body is tight. The study found that in deciding whether to like someone or trust someone, a person's body language and vocal tone was worth 93%. The words themselves only count for 7%. This is why it's important to not only use our 5 tones tool, but also ensure we have an alignment between our words, voice, and body as we use it.
Today, you've shown us many examples demonstrating how small changes in the way healthcare workers talk to their patients and colleagues can make all the difference toward having thoughtful interactions. That's all for today's episode of Wake Up for Safety. Tune in next time when we explore the last letter in our safety acronym. It's going to be great. But don't take my word for it. Tune in and see why for yourself.
The coffee is strong, the sun is getting high. Let's wake up for SAFETY.
What a terrific episode. What am I going to watch when this show ends? I don't have to think about that just yet. Instead, I'm going to spend today noticing my tone, adjusting my body language, and practicing thoughtful interactions so that I can create the safest and friendliest environment. And of course, telling everyone I meet about my favorite topic, safety together.